Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
In an effort to identify priority areas for action and catalyzing global change, World Health Organization member states endorsed global targets for improving maternal, infant, and young child nutrition. With only 2 years to 2025, Uganda still has a long way to go to meeting the goals. Nutrition specialist Dr. Edward Mwesigye explains Uganda's performance regarding the 6 key targets. The first is to reduce stunting by 40% of children under 5.
Whereby somebody is having low weight for the height. I mean, we are not doing very well with the stunting because it has actually remained at 29% for the last 4 years.
This is followed by a commitment to reduce anemia in women of reproductive age by 50%, reduce low birth weight by 30%, eliminate childhood overweight, increase exclusive breastfeeding in the first 6 months up to at least 50%.
The rate of exclusive breastfeeding is very low in Uganda. And mothers tend to start their children on other foods. But this child's digestive system is still very poor. It cannot easily digest the food. So, and also the way these mothers prepare the foods is in an unhygienic situation, whereby these children can easily get diarrhea. We need to get workplaces which support, protect, and promote breastfeeding. Our mothers or the caregivers, they don't really provide adequate complementary foods. Actually, most of the stunting studies show that, and most of the types of malnutrition, actually they start at this period when the child has started on complementary foods. Because the complementary foods are mainly staple foods, these staple food crops are deficient in iron. And iron is one of the key important micronutrients which leads to anemia.
Dr. Mwesigye, however, says Uganda has managed to suppress wasting to less than 5% for 2 years consecutively.
It is around 4%, which is below 5%. But the main issue, are we able to maintain that level? So that one is a very big question. But also, there are disparities within the country, different regions. You find like in Karamoja, it is pretty high compared to the national prevalence.
As experts explain, poor nutrition has an effect on the quality of the population and its productivity.
So when somebody does not have the proper nutrition, we have a term for it. It's called malnutrition. So we have the lower end where we have undernutrition, and then we have the upper end where we have overnutrition. And for undernutrition, an individual is not getting the right amount of nutrients to support their health and well-being, whereas at overnutrition, they're getting an excess. And each of these areas poses different threats to their life and their well-being in general.
We have things like cognitive development. If a child is stunted, this child won't develop mentally to that capacity, whereby in future this child will have to struggle to achieve the educational goals. We shall get people who are not innovative to address the problems of the country.
So at all stages of the life cycle, one needs to have the proper nutrition guidance so that they can have optimum health and they can be able to work as a very enterprising citizen of this country, a healthy citizen of this country, and they can really fulfill their potential in every area of their life.
Dr. Mwesigye says government should ensure that the population is able to access a nutritionist at least at the lowest point of healthcare.
For example, just from the sub-county level, because at the sample county level there is health center 3. We have so many now people who have trained in nutrition from diploma level. At sub-county level, you can put a nutritionist at health center 3. At the same time, is working at the sub-county as a community nutritionist. Such that, but you find that in health center 3s, health center 4s, we don't have nutritionists as per now. They usually start with at the general hospital, which in quotes district hospital. And you can imagine, we only have one nutritionist in the whole hospital. You will find them in the pediatrics ward. But also the issue is that, like for example, you have like 5 sectors in the hospital. Maybe you have general medicine, pediatrics, maternal child health, or obs and gynae, where you find the pregnant mothers, antenatal care. So don't expect one nutritionist to run to all of those wards, surgery, because all this, like also somebody to chew very well needs to eat.
It is estimated that undernutrition costs Uganda about 1.8 trillion shillings, an equivalent of 5.6% of its GDP annually. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.